We perform injections during the time of your surgery to minimize your pain after surgery. But most men are going to have some discomfort. Obviously, it's a sensitive area of your body, and so it's not uncommon to see some pain or discomfort. Tylenol and ibuprofen for most men, if you're able to take it, will control the majority of that pain. We will also send you home with some narcotic pain medication to use in case you need it. After your surgery, we'll put a wrap around the scrotum and the penis to help prevent swelling and bruising. After that comes off on post-op day number 1 or the day after your surgery, we recommend using some sort of tight-fitting underwear or jock strap, which you'll also be given at the time of your surgery. In addition to that, using some ice or frozen peas and corn as ice down in the scrotum and testicles can help decrease bruising or swelling after your surgery. The incision site is closed in multiple layers with absorbing sutures. What that means is that the sutures will dissolve on their own. Over that, there's going to be a little skin glue. That skin glue is going to come off over somewhere between 2 and 10 days normally after your surgery and will come off on its own. There's no specific instructions that you need to use at the incision site. In order to get a good location of the pump in the scrotum between the testicles, it's important to help pull down on the scrotum and pull down on the pump. The amount of bruising and swelling you have in the scrotum will determine how well and how easy it's going to be for you to pull down that area, as well as for some men we're going to have you pull the pump from the back of the scrotum to the front of the scrotum to get it into a more accessible spot. Most guys, by a week or 2 after surgery, we're going to have them start to kind of pull that pump and get an idea of where that pump is located and where the inflation and deflation valves are for that. This will all be in your post-operative instructions. Constipation is pretty common after surgery. That's because of the anesthesia and the pain medication that we give you, and potentially the pain medication that you take at home. To avoid constipation, stool softeners can be really helpful. Making sure you stay really well hydrated can also be helpful. If you need, most stool softeners are over the counter. If you haven't had a bowel movement by 3 or 4 days after surgery, you need to give us a call and we can get a suppository or something else ordered for you. You can take a shower starting at post-operative day 2 or 2 days after your surgery. Baths, hot tubs, things like that we like to avoid for 3 or 4 weeks after surgery while everything's healing. Heavy lifting, things that are going to kind of put stress or strain on your belly, we like to avoid for a few weeks after surgery, normally 2 or 3 or 4 weeks. I'll see you for a post-operative appointment at 2 weeks after your surgery and we can have a further discussion about how things are going and how well you're healing. As long as you're off pain medication, you can start driving around. Most guys are going to notice that for probably about a week or 2 after surgery, depending on the kind of work that you do, but if you're doing heavy strenuous activity or heavy strenuous work, you're probably not going to want to do that. Normal work behind a desk or computer or things like that can be started normally just a few days after your surgery or maybe a week or 2 after, kind of depending upon what kind of work you do. If you have any questions about this, my office is happy to answer these for you. It's a sensitive area of the body, so for most men, they're going to be a little bit sore down there for about a week or 2 and then kind of turn the corner. Once they turn the corner, then within 3 or 4 weeks, they're going to feel back up to their usual activity. And by 5 or 6 weeks, like we talked about, you're going to be able to use the device and be back up to 100% of your normal activity for most patients. It's normal to see bruising or swelling after surgery, but significant bruising or significant swelling are reasons that we should be notified. Also, if there's any signs or symptoms of an infection, fevers, chills, drainage from your incision site, or redness around the incision site, those are things that we want to know about for sure. Obviously, if you have any questions or any concern, our office is here to answer those questions, but those are the ones that we worry about the most. Typically, you'll have a 2-week and a 5-week post-operative appointment. These appointments should already be made for you before your surgery is scheduled or at the time of surgery being scheduled. If they're not, give our office a call on the Monday after your surgery and we can get them arranged for you. In most scenarios, though, they're going to be already pre-scheduled and pre-arranged. Depending upon how well you heal and the amount of bruising or swelling will determine how quickly you can use the device. Most patients are going to be able to use the device somewhere between 3 and 5 weeks after their surgery. depending upon the ability for them to feel the pump and especially feel that deflation valve. Give my office a call if you have any questions or any concerns after your surgery. We're here to answer all those questions at Evergreen Health Urology.